The goal today is to get people out of the classroom and a little bit out of their comfort zone and get them a little bit of education in things that they may not necessarily experience and things that you typically wouldn't experience but you may be called on to act in some of these situations. We're going to do scenarios involving a mauling by an animal, a gunshot wound, which is not an uncommon thing for an emergency medicine physician to encounter, lightning strikes, which are of course always a danger in the summertime with any outdoor activity, and a very common scenario that we're going to run through is anaphylaxis to bee stings, which is really no different than a bad peanut allergy that many people are familiar with.
My friends got struck by lightning.
So when I first got there was 3 patients that were just laying on the ground, and you don't really have much to work with, and you got someone screaming for help. So initially you're kind of surprised and you're a little nervous, but then your training kicks in and you get your colleagues to help you to treat the patients. So the first thing we had to do is triage the sickest patients from the least sick patient and provide emergent care to the patients who needed it the most. I think the hardest part of the exercise was trying to figure out what resources were available to you, and when you realized you didn't have something that you needed, to improvise in order to provide the best care to the patient.
It's okay. It's all right.
This is a great team building exercise for the residents in emergency medicine and family community medicine. It helps to build collegiality between the two programs. We work very closely together, and although we're in different departments, we do have very similar interests.
Got a stick behind.
Hey, sir, how you doing? Good. All right, we're talking. Everybody's good.
I think when you get hands-on experience like we did today, it really sticks a lot better. You learn a lot more from actually practicing with the tools that are provided to us, rather than kind of sitting in just a classroom and having someone give you a lecture. I think that you learn a lot more when you get to practice the medicine.
I think that any exercise that allows us to work better together helps us to provide better patient care, which is really what all this exercise is about today.